Blenders, we have today somebody very special. Please try to stay tuned the whole episode, please, the whole program, because we will have several important information to share, because we have here today Dr. Danny Yakoub. He is a surgeon oncologist from University of Miami. Thank you so much for being here.
Pleasure, thank you.
Dr. Yakoub is from Egypt, right? So tell us a little bit about this transition to the US. How actually did you choose to move to Miami, to the United States? And
so I'm a proud Egyptian American, and I graduated my medical school and did some basic surgical training in Egypt, and I realized I wanted to do more. More in terms of better health care for my patients, more research to advance my specialty and my practice. And I felt that the resources to do that would be more available in a place like the United States. Mm-hmm. However, I got an opportunity to do postgraduate research in England. So I went to London, where I spent 5 years there. I worked as a part-time surgeon, and I actually obtained a PhD from Imperial College London, one of the very prestigious places there. I learned how to approach cancer research in terms of investigating cancer metabolism. Interesting. After that, I went on my aim and to come to the United States, where I moved to New York. I did my general surgery residency in New York, and then I applied for a fellowship in cancer surgery at the University of Miami. I was accepted, and I came and did that. During this fellowship, I did some additional research, and then I was appointed in the university as a cancer surgeon with interest in cancer metabolism research, and here I am.
You just told me, like, it's such a long time of studying and never stops, right? So how many years altogether since you started in? After medical school, I'd say I spent 4.5 years in London, 4 years in New York, and then I've been here in Miami for the last 6 years. So in the United States, the last 10 years. Okay, so you moved first to New York and then Miami.
Correct.
Okay. Since you're talking about New York and Miami, changing a little bit the subject, what is how did you feel when you moved, as far as cultural and because New York, it's more like, it's cold, it's completely different from here. Can you tell us a little bit about the pros and cons of Miami and New York?
Absolutely. The United States in general is a great place for an immigrant, because it's a melting pot. It has everyone coming from everywhere to try and do better. Miami, I think, still represents that principle more than many other parts of the United States. When I came to Miami, to me it felt just like home. The weather in Miami is just like the weather in Egypt. The orientation of the more of Hispanic majority was exactly like how I grew up, family oriented, warm feeling, warm people, like to have fun, and at the same time, when it's time to work, they work hard. So it felt really comfortable to be in Miami, and that's why I applied and I wanted to stay down here.
Wow, very interesting. Now, I know that everybody knows what cancer means, and do you treat a specific kind of cancer, or do you focus more specifically in one part of the body?
Right.
How do you?
We take 2 years of cancer surgery training where we get trained on managing multiple types of cancer. And then when we finish and start practicing, you start broad by treating almost everything, and then you start focusing on a particular organ system or area. My passion, and I'm very passionate about what I do, is mostly combined between GI cancers like stomach, esophagus, pancreas, liver, as well as breast cancer, which is basically the most common or the highest number of patients, unfortunately, coming to our hospital. And we have a very comprehensive team to treat those cancers, and that's what I do.
Okay. Dr. Yakoub, now, we heard, now talking about something very basic. When you hear that you have cancer, now you schedule the surgery. Does it mean that whenever you do the surgery, the patient will be cured, like the cancer will be gone, or not? Because we have that thought, oh, okay, she's going to have surgery and then she's going to be okay, right? And then on the other hand, it's like, no, she will not have the surgery. That means she's going to die. You know, we have people talk a lot about that. They have those stigmas, I guess I can call like that.
I have to say, medicine and surgery is one of the most rapidly advancing sciences and services. I always tell my patients the right place for treatment is not really or only the right doctor. It's the right team, the right place, the right system. It's a comprehensive care. I, as a surgeon, I'm not the only one providing the care. I have an assistant, a nurse, an ICU, a medical oncologist who helps give chemotherapy, radiation oncologist who could give radiation, other people who would give other forms of therapy like immune modulators and so forth. In addition to our research projects, again, to advance all that at the same time. When a patient comes to me, we have two aims of doing surgery in cancer. The more favorable and what we want to do for everyone is the curative intent. Basically, if surgery can remove the whole cancer burden in the body, that's what we do, and that is done with a curative intent. Hopefully at the end of that we can tell the patient you are cancer free. However, our knowledge of the complex mechanisms of cancer development and progression, we know that sometimes some cells can escape either locally or escape in the bloodstream, and that's where other teams come in the picture, like having chemotherapy and radiation and immunotherapies. Combined between surgery and those teams, that is our goal for every patient, is at the end of that, either surgery alone or surgery combined with many other things, to tell the patient happily that you are cancer free, and we continue to follow them for quite a long period of time.
Sure. Okay, I understand, because I was not quite sure. A lot of people say, you know, surgery, it means that. Okay, so you clarified a lot.
We've progressed a lot. In 30, 40 years ago, very ultra-major surgeries used to be done and still with failure to contain or to remove the whole cancer. Now we use alternative therapies like chemotherapy and radiation, sometimes to shrink down the tumor and limit it to a certain area, and then we remove it surgically. Or we can do that in a reverse sequence, like do the surgery and augment it with additional therapies. Again, a place where all those comprehensive therapies are integrated together is the right place to have cancer treated.
Got it. And also, I think the stages, it makes the huge difference, right?
Absolutely.
Stage
Absolutely.
1, it's 1 through 4.
As early, the only hope of getting a cure for any cancer is detecting it early and treating it early and aggressively. And that underlines the importance of screening programs. Like, for instance, for breast cancers, before we had the screening mammography for women above 40 years of age, women used to present to us at a late stage, only when you can feel the tumor. And that's already kind of advanced. Now with the screening, we detect cancers when they are like a 1 millimeter or 2 millimeter stage. On a mammogram, we see something and we address it, and then we can, that's when we really achieve a complete cure for decades after that. Other cancers are similar, like colonoscopies for colon cancer. Certain people with known genetic predisposition to development of cancer, we subject them to specific screening programs to look in the areas where they are more likely to develop that, so that we catch things early and we treat it and we finish it.
Okay. And as far as the mammography or mammograms, why, I don't know if it's a question for you, but why sometimes we do the mammograms and they ask for an ultrasound? It's just to make sure, or it's a sign that you have something wrong, or, you know? No,
not necessarily. It's just that each imaging modality looks at a particular thing. So, for example, a mammogram or an X-ray or a CT scan can see signs like calcifications, like small deposits of calcium, which could signify a presence of a developing cancer. However, a complementary examination like ultrasound will look at a different thing that can look better on soft tissue masses. So each of them looks at a different aspect of the cancer. So they are complementary to each other rather than different or repetitive.
Okay. And also another question about the mammogram. So now I keep asking, I'm sorry, but they say that whenever you detect a mass or a cyst, I don't know, in your breast, it's been there for a while, for I don't know how, a few years. Is that true?
Correct. There has been so many studies to try and generate an idea about how long does it take for a cancer to develop from cell number 1 to like a 1 centimeter mass or a 10 centimeter mass. And people have changed different reports saying that it could take you a couple of years before a mass could reach the size of a 1 centimeter. I think it all depends on the cancer biology. Some cancers are rapidly progressive, they grow very fast and they don't take time to develop. Others take a long time to develop. And actually that has a bearing on the outcome of treatment as well. The more favorable the biology of the cancer, or the less aggressive it is, the more able we are to treat it successfully with no recurrence. So the period is hard to underpin. However, what we can say is don't miss your screening. If you're due for screening, don't miss it, because that could be the chance for early cure.
Screening, mammograms, and call the doctor, call the physician, because it's better just to be safe than sorry.
That's a very important thing. Many of us, I grew up in Egypt, and in my culture, it sometimes is more accepted to not complain. Like they try to teach you not to be a complaining person. If you feel some pain, oh, it's just a little thing, keep going. And then you end up having a problem that could advance. This is actually one of the major differences of outcomes of cancer treatment between developed countries and less developed countries, because the general culture is when you have a problem, you go to the physician, you detect it, you check it. If you confirm that there is nothing, then we know it. If you don't, then we treat things early before they progress and become a bigger problem.
That's the message, treat early. Dr. Yakoub, now, talking about immigrants again, or people from outside who wants to come to the US. Any advice you can give them? Because we know, trust us, it's very hard, and I want to actually congratulate you, because being at University of Miami, which is a very competitive place for Americans, and you can imagine what it is for a person who is coming from outside. So it's a great victory for you. So congratulations, just to pass that screening. Do you have any advice you could give to our friends and people who wants actually to come to the US to be a doctor as well, like a physician like you?
Absolutely. I have to say what they call the American dream is true, and it's actually not the American dream. It's the dream of people who want to come here and establish a full productive life. I haven't done this alone. I've been married since I was in Egypt, and my wife has supported me all steps of the way. If she hadn't been so supportive, I couldn't have the time and effort and perseverance to get through all the steps and the checkpoints on the way to reach where I am right now. I have to congratulate her as much as myself, as she has done the same. And I want to tell everyone it's not impossible. It's like an iceberg. I may be sitting here looking like an example of success, but this is like an iceberg. What you see is much less than what has been gone through along the way. Lots of work, lots of frustration, failure at times, and then success. I've been blessed, I've been lucky, and I worked very hard. And I think everyone who succeeds to progress in the United States have had this desire of success, and the perseverance and the will to make it happen. And I think everyone can. If I can do it, everyone can do it.
He worked a lot and studied a lot, and let me open the parenthesis, because his wife, she's a physician as well, and she did part of the residency and the career while she was pregnant and with the kids, which is not easy. Everyone that who knows that has kids and go to another country, it's very hard.
My wife inspires me with her perseverance as much. I didn't have to become pregnant. And in bringing up the kids early on, she was there all the time, in addition to doing double the effort to take care of her.
Be a woman, right?
Exactly.
Because it's harder.
And her exams and her training, and she's gone through all that. And she succeeded as well.
She's going to be here soon. Yes, so Dr. Yakoub, I want to thank you so much for your time, and again, we're going to bring his wife. She's going to tell us a little bit about the double life, right, at home and then at work. And Blenders, thank you very much. Please share our video, like and subscribe the channel. Thank you so much again. Watch us.